ആടെ ഇനി സോയ വാങ്ങിക്കുമ്പോഴത്തേക്ക്
Good evening, dear delegates. We are on to the 5th day of Smriti Tarangam. So, shall I welcome Dr. Rakhi to introduce the speaker?
Thank you, ma'am. Good evening, all. We welcome you all to the 5th day of National CME on Pediatric Epilepsy, Smriti Tarangam. So far, we have dealt with the basic concepts of Apasmara and epilepsy, along with the clinical experiences and the research works done so far in the Department of Kaumarabhritya, Government Dada College, Thiruvananthapuram, in the field of Apasmara. Today, we have Dr. Lakshmi M.K., Associate Professor, Department of Kaumarabhritya, Government Dada College, Thiruvananthapuram, and she will be dealing with the topic Concept of Apasmara with respect to Arogyarakshakalpadruma. She has completed her graduation from Government Dada College, Thiruvananthapuram in the year 2003. She has pursued her post-graduation from the same institution in the year 2008. She has completed postgraduate diploma in counseling and family therapy from ICNOU. She has also done a certificate course in childhood disability management from School of Disability Studies, Kerala University of Health Sciences, and a postgraduate certificate course in nutrition from ICMR. She is currently pursuing her PhD in pediatric nutrition from Kerala University of Health Sciences. She has 15 years of teaching experience and she has been awarded the Gaveshaka Ratna Award for the best Ayurveda thesis in India 2008 by Kerala Ayurveda Limited, and also the Best Paper Award in the International Conference on Early Intervention for Children on the topic Integrative Management of Children with Autism Spectrum Disorders. She has also worked as an NSS program officer and a resource person for COVID-19 warrior training by Central Government Central Ayush Department, and also a resource person in various other training programs. She has presented papers in various national and international seminars in Ayurveda, and she has been a part of various projects, and now the ongoing one is the integrative approach to the management of speech and language disorders in children, Ayurveda with speech therapy in Government Ayurveda College, Kannur. She has published around 7 articles in various national and international journals, and she is the author of the book Sadhana, a complete guide on Kashyapa Samhita, published by Amrita School of Ayurveda, and the co-author of Textbook of Kaumarabhritya and a public awareness booklet, Balakiranam, published by Government Ayurveda College, Thiruvananthapuram, and also the co-author of Handbook of Kaumarabhritya, published by the Government Ayurveda College, Kannur. It's my privilege to welcome you, ma'am, for the session. And over to you, ma'am.
Okay, thank you. Thank you, ma'am. Thank you, Rakhi. So let me share my screen. Hope it's visible and I'm audible.
Sure, perfectly visible and audible.
Okay, thank you, ma'am. So good evening, all. So for the last few days, we were discussing about Apasmaram. We studied about the Apasmaram, the concept of Apasmaram in various Brihatrayis. We dealt with the Nidana, Samprapti, with the classifications, and also the clinical experiences, and also certain field of research. There are certain researches that we conducted in the Department of Kaumarabhritya, Government Ayurveda College, Thiruvananthapuram. So today we are going to another concept. So that is Apasmaram in Arogyarakshakalpadruma. So as you all know, Arogyarakshakalpadrumam is a textbook written particularly for pediatrics or children, Bala. So it is of utmost importance that we as Kaumarabhritya practitioners should get a clear concept or clear idea of Apasmara in Arogyarakshakalpadruma. So I inquired about this the 18 types of Apasmara with many people, but I think it's a subject that should be considered for future research in all the departments of Kaumarabhritya throughout India. So let's move on to our topic. Arogyarakshakalpadruma is actually a textbook written by Kaikulangara Ramavariyar. The Kaikulangara is the place name, and he was an eminent scholar. He was born in the 1832 in the Thrissur district of Kerala. So he has many works to his credit, around 40 works to his credit, which includes original works, and he has also written commentaries on different subjects and also Ayurveda textbooks like Ashtanga Hridaya, and also in astrology, music and literature, etc. And the textbook that is available, the first textbook that was available, particularly in Malayalam, it had 40 chapters. Okay, and as you all know, it is included in the PG syllabus, and the translated one by Dr. Lal Krishna, it comprises of around 47 chapters. Maybe he has in the original textbooks that was not the last part of some chapters were not there, and he has added something on into that textbook. And our particular context of Apasmara, and it is explained in the 32nd chapter of the original textbook. Okay, so coming to the Apasmara, we already studied about the Apasmara Samprapti. So atra Apasmritim Samanya Chikilsa Sahi Apasmriti Bibhalsa Cheshta Samyuktam Stuti Apayo Ya Utkadaha. So it is the same as that we have studied. That is Smriti Abayo Hi Apasmaram, then Bibhalsa Cheshta Samyuktam, Sattva Samplavat. So all this, the same concept is there, Bibhalsa Cheshta, along with the Smriti Sahi Apasmriti. So Apasmriti along with the Bibhalsa Cheshta. So that is the same concept that we have studied in the Brihatrayas. Okay. Then regarding the Nidana, Ahur Nidana Medase, the Acharya has not detailed the Nidana as we have seen in the Brihatrayas. Okay. So it is said that Ahur Nidana Medasya Mano Deha Gadan Malan. So it is said that it is both the malas in the manas as well as the deha. So Mano Deha Gadan Malan. He has not gone into the details of about the Abatya Ahara Vihara or something like that. Maybe the textbook is actually particularly dealing with children, so that may be one factor. And also actually the chapter comes after the Unmada chapter. Okay, so in that also the explanation of what Abatya Ahara Vihara has been mentioned. Okay, maybe due to that Ahur Nidana Medasya Mano Deha Gadan Malan, it is said like that. Tasyam Ulpasya Manayam Hrit Kambadi Vigaravan. Okay, so it is said that due to these Nidanas, Hrit Kambadi Vigaravan. Then how it happens? Chinna Mula Iva Vriksham. So Iva Kshipra. So like a tree is cut down. So like that, the child falls into the earth. So that is Bhumo Padadi Mudadi. So that is being. So it falls down with the epilepsy. So that is what is explained, like a tree. So that is explained. And Virade Dosha Vegetu Swastimcha Swayamrchadi. And after that Dosha Vega is over, the child becomes Swastha. So that is the same thing that is being explained. Only difference is that the Nidana is not being elaborated in this chapter. Okay, so that is the Apasmara Samprapti explained in Arogyarakshakalpadruma. Okay, then he usually explained, like as in Charaga and as in Vakpada, Ashtanga Hridaya, etc. He explains that Apasmara Chadurbhedo Vadadi Nije Enaja. So it is the same division, that is Vada, Pitta, Kapha and Sanibadika. Then Ityege Annehi Punaha Prahur Ashtavidanchatam. So first he classifies it as Vada, Pitta, Kapha and Sanyabada. Then later he says that it can again be classified into 18 types. So here is the difference. So why he has classified it into 18 types? Already he told about Vada, Pitta, Kapha and Sanyabada, but he again divides it into 18 types. So why he has given a reason for this thing? So he is saying that Badodbhavat Bhedena Badhagasya Grahasya. So he had given the reason for the division as the Nidana for the 18 types of Apasmara is due to Badha and or like Graha. Graha Badha or in the Kerala, actually his books are written in Malayalam and Sanskrit language, but in Malayalam literature, I mean Malayalam writing, and in that he has given more. He's more influenced by the concept that was prevailed in Kerala. So in Kerala, the idea was that there are 18 grahas or 18 badhas. In Malayalam, we say graha as badha. So that is why he has given it as 18. Okay, because each type of Apasmara, he has the concept that it is caused by different badhas. That means the graha. So that is why he classified it as 18. He has given the reason like that. Badhodbhavat bhedena badhagasya grahasya cha ashtadashasya yujyante bheda iti tadashayaha. So likewise, due to the nidana or according to the nidana, according to the graha badha, he has classified it into 18 types. Okay, so that is how the 18 types of Apasmara is explained in Arogyarakshakalpadruma. So now we have a question that what is the necessity for studying these 18 types? Anyway, we have to study the 4 types, and that itself is enough, isn't it? Vada, Pitta, Kapha, then Sannivada is there. Only thing is that the 2 combinations are not there. But still, why these 18 types? What is the need for studying these 18 types of Apasmara? Is it relevant or is it important? So that is the thing that we have to look for in our session. Okay, so actually, when we think of the scientific importance or the scientific relevance behind this classification, we can see that actually even in the modern neurology, they have expanded the number of types of epilepsy. When we look into the ICD classification, regarding that autism or say ADHD, they have concised the classification, so that they have reduced the number of types. Okay, but in case of epilepsy, they have actually expanded the number of classifications. So here it comes that is the concept that is in Arogyarakshakalpadruma itself. Okay, so the classification, the number of classifications of epilepsy is more in the modern science also. Okay, so as you all know, International League Against Epilepsy is the authority that deals with the epilepsy and its types. So it has published in March 2017 the latest classification of epilepsy. So actually the first one was published in 1989, and but it was the renewed one was published in 2017 only. So till that time there was no updates in this ILA classification. Okay, so in this 2017 classification of epilepsy, actually they have elaborated or they have increased the number of types of epilepsies. So that is actually in favor of the classification that is being given in Arogyarakshakalpadruma. So there are 3 levels actually mentioned in ILA 2017, that is the seizures, the epilepsy, and the epilepsy syndromes. And they have also given considerable importance to the etiology and the comorbidities at each level. Okay, and in this ILA 2017, they have declared epilepsy as a curable disease rather than a disorder. And it is said to be resolved after 10 years of the seizure-free period, with the last 5 years spent without medication. So the patient is no longer at risk for age-related epilepsy syndrome. So this is the criteria that is given in ILA 2017. The last 5 years spent without medications. So that is being given as a seizure-free period. Okay, seizure-free period for 10 years, 5 years with medication, and 5 years without medication. So this is the latest criteria that is being given in ILA 2017. Okay, then as you know, the prevalence 75% is before the onset of 20 years, and the incidence is 49 per 1 lakh population. Then why they have classified this ILA? Why they have given this classification? Actually, they have given the classification like I already told, that epilepsy, then seizure, then epilepsy syndromes, etc. They have given the classification. They have made the classification based on the clinical semiology, and that means the clinical features that is being seen in the epilepsy patient. Then according to the disease location in the brain, then based on their etiology, and also the associated comorbidities. So this is how they have classified. Why I am saying this here is that the same criteria is being used by Kaikulangara Ramavariyar for the classification. That is, it is based on the clinical semiology. the disease location, etc., the Ramavarya cannot identify, but he has classified it based on the clinical semiology mainly, and also the etiology. As per Kaikulangara Ramavarya, the etiology was actually the Badha or Graha Badha. Okay, so that is how he has also classified. Clinical semiology is the most important thing. Okay, so and in ILAE they have given that for the prompt, they have given the classification for prompt diagnosis, and which will result into early management and then better patient outcomes. Okay. Then, considering the etiology, we have seen the genetic susceptibility, then neural, like cerebral palsy, focal cortical dysplasia, then cerebrovascular factors are there, that is intracranial hemorrhage, ischemic stroke, then other acquired factors are there, like head trauma, cerebral infections may be the cause for epilepsy. Then neoplasms may be a cause for epilepsy. Then metabolic, that is inborn errors of metabolism, may be a cause for epilepsy. Then neurodegenerative, that is Alzheimer's, may be a cause in adults. So likewise, these all will cause actually chromosomal abnormalities, which leads to abnormal neural patterns, or the malformation for the cortical development, or the inflammation and formation of scar tissue that irritates the neural tissue, and the infiltration of the mass, gray matter irritation, then inherited enzyme deficiencies, then protein-rich plaque buildup and brain atrophy. So all these causes damage to the brain and subsequent alteration of neuronal circuitry. Okay, so the neurotransmitter imbalances, inflammatory cytokines may be developed, then altered neurogenesis or gliosis may be there, then ion channel and receptor dysfunction. So this causes neurons fire in burst activity, that is referred to as the paroxysmal depolarization shift, and often in groups. Okay, then that causes abnormal neural activities, that create self-reinforcing circuits and transform the neural network over time, and leading to the epilepsy. Okay, and that epilepsy can cause other clinical features like involuntary contractions, loss of consciousness, post-ictal confusion, etc., or the loss of airway reflexes, then aspiration of saliva or food contents, and leading to aspiration pneumonia. So this is just the pathology. I mentioned it here because this etiology has been a main factor behind the classification. And also seizures, epilepsy, and syndrome. These were the main terminologies that they used for the ILAE classification. Seizures, this has been dealt with in the earlier class, seizures and epilepsy. But the epilepsy syndrome, that also we have to deal with, because we are dealing with children. Epilepsy syndrome is defined as a characteristic seizure associated with abnormal investigations that occur together in a recognizable pattern. Okay, it usually includes more than one type of epilepsy. So it has a characteristic seizure along with some abnormal investigation, means particularly EEG. Abnormal EEG will be there. That is dealt with together. So that if the child presents with these type of features along with this type of particular EEG, then the child will have a particular type of syndrome. So that is how epileptic syndromes are being classified. Okay, so these are the terminologies that are being mentioned in ILAE. Okay, so with this we got an idea that actually the 18 type of classification of epilepsies in Arogyarakshakalpadruma is a little more scientific. That means that type of classification is being dealt with in ILAE also. Okay, then earlier, the classification of seizures, actually this was published in 1981. It was classified into, we all know, that was the earlier term, partial and generalized. Now instead of partial, we use focal. So partial, it is classified into simple, complex. Now the terminology of simple and complex they have removed. Why? Because people thought that they actually did the classification so that the people should identify how their child's seizures are. Okay, so that is how usually the parents will be identifying the type of seizures. So from the term simple, they thought that the parents will feel that it is nothing severe, or it is not much a big problem. So that is why they removed the term simple and complex. Okay, so that is being removed, and partial with the secondary generalization. This is the earlier classification, as you all know: absence, myoclonic, clonic, etc. Then actually, this is earlier it was told as tonic-clonic seizures were called as grand mal. Then absent seizures were called as petit mal. Then now it is actually the focal seizures. Okay, focal seizures with awareness. It was earlier called as simple partial. Actually, now the presentation is focal seizures with awareness. it is said that you should now on do not use simple partial. You have to use focal seizures with awareness. Then focal seizures with impaired awareness. That was earlier called as complex partial. Okay, so these are the new terminologies, and we have to use this thing. And we don't have to use that old terminologies. So this is the latest classification. Focal onset, generalized onset, then unknown onset, and unclassified. So these are the 4 types of classification: focal onset, generalized onset, unknown onset, and unclassified. In the focal onset, we see aware, then with awareness and impaired awareness. And that may be motor onset or non-motor onset. So we have to learn this, because when coming to the 18 Apasmaras, no, we are going to just not that correlate. We can see that the features that is explained in the 18 Apasmaras usually mimic with this, all these things. Okay, so that is why we are explaining this thing in the context of Apasmara in Arogyarakshakalpadruma. So focal with awareness and focal with impaired awareness, that may be motor onset or non-motor onset. Motor onset may be automatism, atonic, clonic, epileptic spasm, hyperkinetic, myoclonic, or tonic. Non-motor onset may be autonomic, behavior arrest. So behavior arrest is the terminology for usually absent seizures, behavior arrest. Then cognitive, emotional, and sensory. Generalized onset actually has motor and non-motor. So that there also we have motor and non-motor onset. Tonic, clonic, clonic, myoclonic, myoclonic, tonic, clonic. So likewise, this is classified. That means the number of classifications has increased, as you can see from the earlier slide. No, the numbers has increased a lot. Unknown onset, that is motor, that is tonic, clonic, epileptic spasms. Non-motor is behavior arrest, and the other one is unclassified. So they don't know where it started or whether it is focal or generalized, like that. Okay, so this is the ILA 2000 classification, the new classification of seizures. Okay, I think all the students, they have to now should be aware of this type of classifications. And coming to the main thing, that is childhood epilepsy syndromes. So this is the classification of the epilepsy syndromes. The previous one was on epilepsy, the classification of epilepsy, and this is the classification of childhood epilepsy syndromes. Okay, so the epilepsy syndromes has also been classified into self-limited focal epilepsies, then genetic generalized epilepsies, then developmental encephalopathy, developmental epileptic encephalopathies. Okay, so these are the syndromes. Then, as you all know, this had already previous names, etc. So that means the self-limited epilepsy with the centrotemporal spikes. So that is the CELEX. We will discuss it in later. That is childhood. It was earlier called as Rolandic epilepsy. Then Celia's is actually self-limited epilepsy with the autonomic seizures. So this was earlier called as Panayotopoulos syndrome. Then the other one is the COVE or childhood occipital visual epilepsy. So this terminology has been explained in the later period. That is POL, that is photosensitive occipital lobe epilepsy. Then there is genetic generalized epilepsies. These have epilepsy syndromes with generalized seizures. Okay, so that we will discuss with it later. That is epilepsy with myoclonia, etc. So they were all previously called as G1 syndrome, etc. like that. Then developmental epileptic encephalopathies are there. That includes the DOOS syndrome, then Lennox-Gastaut syndrome, so Landau-Kleffner syndrome. So likewise, different syndromes. And then FIRES is actually febrile seizures. Febrile seizures include a febrile infection-related epilepsy syndrome. Okay, so likewise, this is classified. That is, childhood epilepsy syndromes are classified into self-limited focal epilepsies, then genetic generalized epilepsies, then developmental encephalopathic epilepsies. Developmental epileptic encephalopathies. Okay, so likewise, these are classified in the childhood epilepsy syndromes. So I think now you got an idea regarding the classification in the ILAE 2017. So in the epilepsy and the childhood epilepsy syndromes. Okay, now we'll move on to what is being explained in Kalpadruma. So Kalpadruma, as we all know, it is classified into 18 types. So the 18 types, it is given, but thank God that he has not given particular names for that. Like in Graha, we studied no different names. Actually, it is caused by Graha Bada, but he has not given particular names like Skanda, Skanda Graha, etc. he has given only Pradhama, Didiya, etc. So it is easy to remember. Okay, so I have just made an effort to just classify it according to the dosha predominance. Actually, when we view the all the clinical features of this Apasmaram, we can Ashtadasha Apasmaram, we can see that all these are mostly Sanibadika, because it is said to be caused by Graha, and also it is being explained that the management explained is actually always Sapnya Prabodhanam, that is Nasya, Anjana, etc. So from all these things, when we consider the Ashtadasha Apasmara, we could see that all this may be Sanibadika. But regarding the semiology that is being given in the Ashtadasha Apasmara context, I just classified it into with the dominance. That means Pitta you can see as Pittotara Sanibadika, Kapha you may see as Kaphotara Sanibadika, like that. So Pitta, Dvidiya, Tridiya, Chadurtha, then Shashta, Ashtama, Navama, Dashama. All these have usually a Paitika clinical features that is being explained. Okay. Then the Pradhama, Saptama, Trayodasha, and Panchadasha. These four have usually Kapha dominant clinical features that is being explained. I mean the clinical features that is being explained in the context of Apasmara in the Brihatrayis. Okay. So that is the clinical features are almost similar to that of Kaphaja Apasmara that is being explained in the Brihatrayi. Pradhama, Saptama, Trayodasha, and Panchadasha. Okay. Then coming to the Egadasha, Dwadasha, Chadurdasha, Shodasha, and Ashtadasha. These have almost Vada dominant, Vadottara, Sanibadika conditions. I mean clinical features, semiology. Okay, so this is how we can classify the Ashtadasha Apasmaras. Okay, and in that the Saptadasha Apasmara, or the 17th one, it has all the clinical features. It has no dominance, and it is considered as the most non-treatable one, or Asadhya one. Saptadasha is the Asadhya one. No treatment is mentioned at all for the Saptadasha one. Okay, and the Panjama, we can see that both Vada and Pitta features are equal in the Panjama Apasmara. Okay, so this is how we can classify those Ashtadasha Apasmaras in the dosha context. This is for the easiness of our study in the study of the Ashtadasha Apasmaras as well as in the management. Okay, so this you can this is how we can classify it as per the dosha. Now we'll go on to each of the, the general treatment that is mentioned in Apasmara. So after explaining, actually he starts with the classification. Then he tells about the general treatment in Apasmara. Okay, he gives an explanation of a general management, and that general management is actually only kridas. He has mentioned several kridas. After that only he has explained Pradhama Apasmara, Didiya Apasmara, like that. So in the general treatment of Apasmara, for all Apasmaras, he has mentioned Vilya Panchanga Krida. So Vilya Panchanga Krida, as you all know, we have already studied. We have already discussed about the thesis that had been, research that has been done in our department, and Vilya Panchanga Krida is very effective. Actually, it contains all the 5 parts of Vilya, plus along with the Panchagavya. So the Panchagavya, and he has given an explanation of how that Panchagavya, what is the ratio of Panchagavya that has to be added. So he has said that the krida, how much krida you want to make, take the krida, and 1/4 of the krida gomutra should be added. So gomutra is the quantity of gomutra is 1/4 of krida, and the gomaya rasa is half of gomutra. Okay, so half of gomutra. Then the dadi will be 5 times that of krida. And Kshira, you should add 8 times that of Krida. So likewise, he has mentioned about the Panchagavya, the ratio proportion of the Panchagavya that should be added in the Vilya Panchanga Krida. Okay. Then he has explained about a Brahmi Krida, then a Deshamuladi Krida, and Maheshwara Krida. This Maheshwara Krida and all is a very big yoga which contains a lot of Jangama Dravyas also. Okay. So, but Brahmi Krida and Vilya Panchanga Krida, etc., we can easily make. Okay, so this is a general treatment that has been explained for Apasmara. Okay, in Arogyarakshakalpadruma. Now, coming to the Pradhama Apasmara. So, Pradhama Apasmara, I tried my best to give give a proper explanation for this thing. Hope if you have any suggestions, please add on. Or if there is any error in this, please mention this. Okay. So Pradhama Apasmara, it is said that Smriti abhayam avasmaram prathamam samprajikshare padananandaram estu pradoshe jayade nrina. So there is no much detailing regarding pradhama avasmaram. It is said that the child just falls. Padananandaram estu pradoshe jayade nrina. So that is the only explanation. It is said that during evening hours, the child falls down. So this can be usually correlated to the atonic type of seizures, where that is called as drop attacks. Okay, as you can see from the video, that is, these children usually they will be protected with the helmets. See, this is a sudden fall. This only fall is there. So no loss of consciousness, nothing is there. So just an atonic type of seizures called as drop attacks. Okay. So that is being explained as Pradhama Avasmaram, Smrityabhayam Avasmaram, Pradhamam Samprajikshade, Padananandaram estu pradoshe jayade nrina. Okay. And he has given a treatment for this. He has told that Nasya should be done with Kimshuka Tvagadi along with the Stanya. Kimshuka Tvagadi yoga should be mixed with the Stanya, and the child should be done given Nasya. Then he has explained a Padmadi Tailam. And Padmadi Tailam also has Jangama Dravyas, and the main thing is Mayura Vichaksharam. Mayura Vichaksharam should be added with the Padmadi Tailam. Okay, and the main another important treatment that is being mentioned in the Arogyarakshakalpadruma in all Apasmaras usually is what? Todu Tailam. Maybe Todu Tailam in Malayalam actually means you just put the tailas or apply the tailas, a little taila in the marmas as well as in the joints. Okay, marmas as well as in the joints and also in the jihwa. So that is called a Todu Tailam in Malayalam. That Todu means a drop or touching the points with the Tailam. Okay, so that is Padmadi Tailam mixed with Mayura Vichaksharam. So it's Lebana in the Jihwa, and also it is Padmadi Tailam can be used for Nasya. Then Bahula Patrotha Pasma, another Pasma is mentioned, and all these Apasmaras usually have a Deva Vebasre Chigilsa. And in this context, actually he has told to do the Varahi Mantra. So Varahi, different mantras are being mentioned for different Apasmara because the Nidanam itself is told as Grahabadha. So Badha. So that is why in every context he has told different mantras. Okay. Then, so hope you are clear of the Pradhama Avasmaram. That is atonic type with a drop attack. Okay. That is Pradhama Avasmaram. Then coming to the Dvidiya Avasmaram. Dvidiya Avasmaram, no, it is actually Sada Snana Abhilashascha, Snanascha Shwayadu Tano, Udare Vebadu Sapnya Mokhascha, Padanam Kwajit, Asya Fenasya Samsravo, Nabhe Uchunada Abija, Lekshande Esya Tam Vidya, Dvidiya Avasmrade Padam. Okay, so it is tiredness, it is actually Snana Abhilasha. Maybe the body is getting too hot, so always the patient wants to have snana. Then it is all the features we usually have abdominal features, that is pain in the abdomen, then unconsciousness, then frothy saliva, elevation in the umbilical region. So that is usually the presentation starts from like that of a simple partial seizure with abdominal aura will be there. So that is the presentation usually given for Dvidiya Apasmara. Okay. So as you can see from this video, please see this man, this onset of abdomen. He was speaking to someone and he suddenly has a retching, something like abdominal discomfort, that is rising sensation like butterflies in the stomach, like that. So that feeling. So that automatisms, that abdominal feeling. So that is the aura. So that is being that starts with the okay, so this is the starting, that is Udare Vebadu Sapnya Mohasha Padanam Kwajit. So after this is the aura, after that the patient may go into unconsciousness. Okay, then Fena Samstrava, Nape Ruchunadavya. Anyway, the main features deals with actually the abdominal features. This is actually explained in this childhood epilepsy syndromes like self-limited epilepsy with autonomic seizures, or celias we can shorten as. This was earlier known as Panaitopoulos syndrome, or early onset benign occipital epilepsy. Okay, so this main features are focal autonomic seizures with or without impaired awareness. Then autonomic symptoms often involve prominent retching and vomiting, but may also include malaise, pallor, flushing, abdominal pain, pupillary or cardiorespiratory changes. Okay, so this is the main clinical features of this Dvidiya Apasmaram. So this Dvidiya Apasmaram, we can correlate it with this celiac or self-limited epilepsy with the autonomic seizures. Okay, that is being explained as this is self-limited autonomic seizures. It starts as autonomic and then it can forward to tonic and tonic-clonic like. Okay, so that is being explained as celiac. Okay, so that we can correlate it with the Dvidiya Apasmaram. And in the Dvidiya Apasmaram, he has given the Varahi mantra and many Mayuri Vidya. Then he has given a Nasya, that is Durvadi Nasya. So Durvadi Nasya is being explained in Dvidiya Apasmaram. Then Hasti Vishtadi Guliga. Hasti Vishtadi Guliga can be given with the Stanyam or Kridam. It is internal administration of this Hasti Vishtadi Guliga. That is why the Jangama Dravyas, the use of Jangama Dravyas is much more in this thing. Then that is the even the feces of elephant. Such things are being used in this context. Okay. Then Shashalohita Thailam. Shashalohita Thailam, it is also told as a Todu Thailam, that is its Lepana in Jihva, Nasya, and it can also be used as Nasya and Pana. Okay, so that is Shashalohita Thailam. That is the blood of rabbit and also the coconut oil, and then the hen's hen's fat. So likewise, many Jangama Dravyas are being used in this Dvidiya Apasmara treatment, that is Shashalohita Thailam. Okay. So then coming to the next one, that is the Tridiya Apasmara. In Tridiya Apasmaram, it is said that Padanam Nashta Sapnyam Dender Pudala Dharanam Vinmutra Nirgamaschedi Chadushkam Esya Drishyade Tridiya Apasmriti Grastam. Then Tam Viditwashanavanam. Then you have to do emergency Nasya. So it is falling down to the earth, then loss of consciousness, then scuffling the floor with teeth, then passing of urine and stools. Okay, so it can be actually with a sudden tonic type, then leading to the tonic-clonic type with incontinence of urine and bladder. So likewise. Okay, so I think so the child, I think you can see it clearly. The child is from a CCTV. So it falls like an atonic fall. Then after that, the child is getting about tonic-clonic seizures. So clonic seizures. So with passing of urine and stool. So this is Padanam Nashta Sapnyatam, then there Pudala Dharanam. So the child will have other features also. Okay. So this is Tridiya Apasmaram. Then for Tridiya Apasmaram, we can he has mentioned that Durva Marijadi Guliga with Stanyam for Nasya and Arya the Eranda Thailam for the Lebana in Jihwa and Nasya. I think as Kaumarabhrite practitioners, we should encourage the use of this Lebana in Jihwa because the absorption, buccal absorption is much more. So that is why they have already explained many Lebana in Jihwa and different types of Nasya in the management of this Apasmara. Then coming to the Chadurtha Apasmara, it is this Drishti Pradosho Badhivyam Padanam Bodha Viplavam Pakratwamja Tanu Tulyam Jayade Esya Dehinaha Tudya Apasmarendam Nyatva Nisatnyadam Gadam. So it is Drishti Pradosham. So it affects it has a visual it affects the visual sensation. So there is this Drishti Pradosham. So we can sudden maybe that it is only pradosham, it may not be sudden loss of vision or like that. And another important feature of this it is Dhanu Tulyam Vakratva. So Dhanu Tulya Vakrata means actually a tonic phase. So that is from the picture you can see a tonic phase, Dhanu Tulya Vakrata. So it is a tonic type of seizure. It is not mentioned any movements or something like that. It is a tonic seizure. Okay, so that is with the visual involvement or visual hallucination or visual effect like that. Okay, so actually, see in this video, you can clearly see a Dhanutulya Vakrata. See, the child is having a tonic seizure. It is just a tonic seizure with a Dhanutulya Vakrata. As you can see, it is similar. What presentation is there in this thing? That is Dhanutulya Vakrata. I have given only the 4 videos from the YouTube because now the ethical concepts are more, and this is an online presentation, and we cannot present the cases in an online platform. That is why I didn't use the videos of our patients. Then this can usually be correlated to, we can consider this as, or we can don't use the term correlate, we can consider this as childhood occipital visual epilepsy, that is COVE syndrome, or late onset benign occipital epilepsy. It's also called Gastaut syndrome, often followed by headaches with the migrainous features. Okay, so these are the features that is being explained in this type of Apasmara. And it has actually elementary visual phenomena, multicolored circles may be there. Maybe that is drishti pradosham, with or without impaired awareness, or with or without motor signs, or deviation of the eyes or turning of the head like that. Okay, then seizures arise predominantly or exclusively from wakefulness. Okay, so that is childhood occipital visual epilepsy, COVE syndrome. Okay. So this we can consider it as the Chaturtha Apasmara. Then another one similar type. In in other 2 Apasmara also we can have this Drishti Pradosham or Drishti involvement of the eyes. There also you can consider these things. That is photosensitive occipital lobe epilepsy. That is POL. In this focal sensory visual seizures are seen, which may evolve to bilateral tonic-clonic. So all this starts with the visual seizures, but later it can progress to the bilateral tonic-clonic type. Okay, then seizures are triggered by the photic stimuli such as flickering sunlight, etc. Okay, so that is called a photosensitive occipital lobe epilepsy. So COVE and POL, these 2 are the syndromes, the pediatric epilepsy syndromes that is caused by this visual stimulations. Okay, or that is related with the eyes. So these 2 we can consider in the case when we are explaining about the Chaturtha Apasmara. Okay. Then in the management of Chaturtha Apasmara, he has given Bhunagadi Taila, Bhunagadi Guliga. Okay, Bhunagadi Guliga, so you know, earthworm. Actually, Bhunagadi Tailam is also there, that is mentioned earlier. Then Bhunagadi Guliga, this is triturated in Drona Pushpi Sarasam, and it is to be given as Anjanam. Okay, then Deshapushpadi Kridam is also mentioned, and it is used for Panam. Okay, and that is the management mentioned for Chaturtha Apasmara. Then coming to the Panchama Apasmara, the Panchama Apasmara, the clinical features actually it is more towards the Pitta side, that is the Daho Vabushi Sarvatra Prishor Uttadada Kshadi. So it falls to the earth. Sapnyayaha padanam pascha sarvageshuja vebadu. So it falls down, then it is vebadu in the sarvadeha, sarvageshuja vebadu. Hastayoho padayoscha abhi shyamadacha shladhangada. So there is shyavada or maybe cyanosis, or if it proceeds for so long, it can lead to shyavada in the hastapada, etc. And jayade panjamena apasmarena athasya dehinaha. So burning sensation all over the body, drifting of eyes, etc. Loss of consciousness, tremors, etc. So this is a type of this type of seizures. That is a tonic-clonic seizures, generalized. Okay. So sapnyaya padanam. So after falling, the child gets the seizures. Okay. Then in the Panchama Apasmara, there is a mentioning of, it is considered one among the Asadhya Apasmara. Okay. That is, we have discussed about Pradhamam, Dvidiyam, Tridiyam, Chaturtha. All this, these are all Sadhya. It is explained as Sadhya. This Panchama Apasmara, no, it is told that if you try to pull the hair out, when the patient is in the floor, and if you are trying to pull the hair out, and if the hair comes out, then it is Asadhya. And the patient will die within 7 days. But if you try to pull the hair and it is intact, then it is treatable. Okay, so this is given as the prognosis of Panchama Apasmaram, and there is Nimbatvagadi Churna is mentioned for Dhubana in this Panchama Apasmaram, and one Shigru Bijadi Guliga. Shigru Bijadi Guliga is triturated in Stanyam, and it is used for Nasyam, and one Padhadi Krida is mentioned for Panam. Then Deva Basra Chigilsa in as Twarida Mandra. So Twarida Mandram is mentioned, and it is told that you have to give the Krida along with the mantra. Okay, so that is Shigru Bija. Many people are doing now researches in mantra and other Deva Basra Chigilsas. So if anyone is there, I think towards the end we can discuss or we can comment on that. Then coming to the sixth one, that is Shashta Apasmara. Shashta Apasmaram is also like febrile seizures. Esya joroshno staptatvam prudesya ja nimnada. Then sapnya nashasya tam vidya Shashta Apasmara pididam. Joro akshno na. Esya joro akshno staptatvam prudesya ja nimnada. It is not ushno, it is akshno. Then sapnya nashasya tam vidya Shashta Apasmara pididam. Okay, so it is fever, stagnant eyes, then congestion of heart, like that. Then it is actually, it can be included in the group of syndromes called FIRES, that is febrile infection related epilepsy syndromes. So many other Apasmara is also there, which can be included in the FIRES category. That is febrile infection related epilepsy. It has a history of non-specific febrile illness in the 2 weeks preceding the seizure onset. Focal and multifocal seizures may be there that often evolve to bilateral tonic-clonic seizures. Then it progresses in frequency and severity to culminate in super-refractory status epilepticus, typically within 2 weeks of onset. Okay, so that is the Shashta Apasmara. It has treatment mentioned is Drona Pushpiswarasam to be used for segam in the eyes. So when you are doing the segam with Drona Pushpiswarasam, if the eyes are open and the eyebrows move on the application of the sega, then it is treatable. Otherwise, it is asadhya. Okay, so Shashta Apasmaram is also one among the asadhya Apasmaras that is being mentioned. And another krida mentioned is the Kudajatvagadi krida. That is used for nasya and also lebanam on jihva and sandhi. Okay, Kudajatvagadi krida. That is Shashta Apasmaram. For the Shashta Apasmaram, Drona Pushpi Swarasam and for segam in the eyes, and Kudajatvagadi krida for nasya and lebana on the jihva and sandhi. Okay. So we have discussed the 6 Apasmaras now, and among the 6 Apasmaras, Panchama and Shashta are considered as asadhya. I mean, it can lead to death, not asadhya, but it is it is difficult to treat. Okay, so it has a yapya nature. So that is 5th and the 6th one. Okay, hope I am hope you can follow. I'm not so fast. Hope you can follow what I'm saying. Okay. So shall I continue? Saptama Apasmara. So coming to the Saptama Apasmara. Uchuna Jadaram Esya Jihwa Stamba Lakshanam. Sapnya Moshatam Vidya Saptama Apasprade Padam. That is, it is also of abdominal character, distension of abdomen, then weakness and stiffness of tongue, then loss of consciousness. So that is in the Saptama Apasmaram. That is Uchunam Jadaram. So it also has the abdominal features, the same as Dvidiya, but Dvidiya has the Pitta involvement also. So we are discussing about the Saptama Apasmaram. It has also that abdominal features and along with the loss of consciousness. It is same as that of Dvidiya, but Dvidiya has some Pitta, Daham, etc. is also mentioned in Dvidiya Apasmaram. So it is same as that of the self-limiting epilepsy with autonomic seizures that we explained earlier with abdominal features. Okay, so Celiac, that is Panaitopoulos syndrome, earlier explained as Panaitopoulos syndrome. So that is Saptama Apasmaram. And Saptama Apasmaram also, Devavabhasraya Chikitsa is mentioned, that is Akhora Mantra. Akhora Mantra, it is told that you have to sprinkle water from a golden vessel along with the Aghora mantra. Then Musta Parpadadi Kridam is another one mentioned, that is for Lebana karma in Sandhi as well as Jihva. Okay, Musta Parpadadi Kridam is mentioned for Lebanadi karma in Sandhi and Jihva. That is Saptama Apasmaram. Then coming to the next one, Ashtama Apasmaram. Ashtama Apasmaram. In Ashtama Apasmaram, actually it is a different one. That is, the clinical features are explained differently for male and female. Okay, so male and female clinical features are differently explained in Ashtama Apasmaram. It is Netrayo Saptada Ratro Jwara Sarvanga Sannada Partradosha Pralabasha Sapnya Nashi Abhi Vandida. So in women, it is said that it is aversion towards males and tiredness, then fever at night, like that. So both has fevers. So maybe a type of febrile illness. Then in the case of men, they have told that Yoshido Esya Punse Esyata Esya Chate Gadaha Jwaradayo Adisatishta Strishu Agasmat Pradhavadaha. So it is excessive sexual desire in case of males, and in the females, it is aversion towards the males. So that is being explained in the Ashtama Apasmaram. And I think it is more of an adult type of seizure. So I haven't gone further details about that Ashtama Apasmaram. It is usually related to adult epilepsy in adults. Okay, and maybe a febrile type because it has fever explained in it. Okay, so that is Ashtama Apasmaram. And Ashtama Apasmaram, usually it has features like that of a temporal and parietal lobe epilepsies. Temporal and parietal lobe, no? So temporal lobe usually has, the epilepsy will have memory, speech, smell, taste, abdominal sensations, etc. And as you know, deja vu that you can, the emotions, no? You can see what is what is going to happen prior to that. So that is what deja vu is like that. So like that type of seizures will be present in temporal and parietal lobe. Parietal lobe also has these type of body sensations that will be present in parietal lobe epilepsy. So this Ashtama Apasmara features usually is, I think it can be like that of a temporal or parietal lobe epilepsy or with non-motor focal seizures. Okay, and in that he has told about Nasya, about Davalekshaka Patradi Swaras. Okay. With Nasya, then Triphaladi Kridam. Triphaladi Kridam is mentioned for Nasya and also in Lebana in Jihva, Napi and Sandhi and Siras. Okay, so that is explained in Ashtama Apasmaram. It is Vella Pechura and Davala Ikshwaga Patradi, Dhavala Ikshwaga Patradi Swarasam. Adana Nasya. It is explained to do Nasya with Dhavala Ikshwaga Patradi Swarasam. Okay, Vella Pechuram. In Malayalam, it is told as Vella Pechuram. So that Swarasa can be mixed with Stanya and it can be used for Nasya. Okay, so that, and also it has Todu, it is not Thailam, it is Kridam, for mentioned for local application in Sandhis and Siras. So that is Ashtama Apasmara. So Ashtama Apasmara is usually of an adult type, maybe temporoparietal. Okay. Then coming to the Navama Apasmara, that is the 9th one. So we have 9 more left, and it also has the features that is being mentioned as latter of a febrile seizure. Jwara Murcha, Shirashula, Sadatyam, Nashta Sapnyada, Kambascha, Dekshine Haste, Shwedur Vamastanu, Uthrida, Rekta Netratvam, Asya Penastra, Nirgamaha, Esya Sasastam, Vijaniya, Navama Apasmratehe Padam. So it has Jwara and also all other features that is being mentioned in a tonic-clonic seizures. It tremors of the right upper limb. Then protrusion of eyes, then discharge of saliva, etc. So it is told that it is mixed with blood, maybe in the extreme type or like that. It can also be correlated to the febrile infection related epilepsy, FIRES, febrile infection related epilepsy. Okay, so this is a type of febrile. This is actually a febrile seizure. Febrile seizure. Okay. Hope you can see the video also. Are you able to see the video?
Yes.
Okay.
Yes.
Okay.
Yes, ma'am.
Thank you. Because I'm not able to see you. No, so that is why I'm asking. Okay. So we dealt with what Navama Apasmaram. Navama Apasmaram can also be taken as a febrile seizures. So in Navama Apasmaram, it is told that it is also considered as one of the or difficult to treat one. That is, it is Niruthamala Mutrada and Shuna Napi is there, then it dies within 7 days. So if the child does not pass urine and stools, and also there is swelling in the umbilicus, then the child will die within 7 days. And one Krida is mentioned, that is the Pashupada Kridam. So Pashupada Kridam is is mentioned everywhere in the Apasmara context, and I search for this when someone is practicing or not. But Pashupada Kridam, I discuss with many people, but they are not making that Pashupada Kridam. I think we as Kaumara practitioners can take Pashupada Kridam for the study in Apasmara. Then it is mentioned as Panam. Then Tulasipatra Swarasa and Tangana can be used for Nasya. So this is being mentioned as the treatment for Navama Apasmara, Tulasi Patra Swarasam and Tangana. Okay. So then come to the Deshama Apasmara, or the 10th one. 10th one is also a Pittaja type of Apasmara. And in this it is mentioned that Dahoshna Jagara Alasya Sadatyam Nashta Sapnyada Jayade Buddhimandisha Deshama Apasmade Nranam. So there is loss of intelligence. Buddhimandyam is there. So it can be taken as definitely a syndrome, Deshama Apasmara, with a febrile fires. We already told, no? Febrile illness related epilepsy syndrome. So that is actually Buddhimandyam. It leads to future, in future it will lead to Apasmara. Okay, and Buddhimandyam, etc. So that is Deshama Apasmara. Then him in this Deshama Apasmaram, no? This hemiconvulsion hemiplegia epilepsy syndrome is also one of the type. That is, in that there will be a hemiplegic episode. Usually it will be followed by after fever. A febrile seizure will be followed by a hemiconvulsion or hemiplegia epilepsy syndrome. Okay, so that episode of febrile hemiclonic status epilepticus, which is immediately followed by permanent hemiparesis. So this is another state, that is fires and this HHE or hemiconvulsion hemiplegia epilepsy syndrome. Both these can be taken together, and if the child has any hemiplegia, then it can be called as hemiconvulsion hemiplegia epilepsy syndrome. Both have fevers in it. Okay, so both will have a febrile type of, starts with a febrile type of epilepsy. So this can also be considered in this context. So in that, Aranya Tulasi Swarasam with Stanyam can be used for Nasyam. And Pashupada or Mahakalyanaka Kridam is mentioned for Panam. Okay. So in the acute stage, always Nasyam should be used. And after that, when the patient becomes stable, you have to give Pashupada or Mahakalyanaka Kridam for Panam. Okay. Then comes the 11th one, that is the Egadasha Apasmara. The 9th and the 10th, we discussed now 9th and the 10th. The 9th was also a febrile type of seizures, and the 10th one was also Dahoshna, a Paitiga type with hemiconvulsion, that is HHE or febrile type of seizure. Then coming to the 11th one, the 11th one was Avachya Anarthaga Pravajanam Shiraso Brahmaha Padanam Resanadamsha Shayanamja Apya Vak Bhave Virava Segarasyeva Vadana Ullekhanam Bhuvi. So it is the swaram or the patient makes the noise like that of a pig. So that is very important. It is considered as a generalized tonic-clonic seizures, that is talking irrelevantly, shaking of head, falling down, biting the tongue, and it makes the noise like that of a pig. So we will doubt actually if there is any noise like that of a pig that the patient makes. Actually, we can have seizures with the patients having the noise like that of a pig. And
skip ahead about 30 seconds if you just, it's a lot of questions. But I look forward to hearing your story.
See the sound, it is what is being explained in the class, it is same like that. It is actually a tonic type of seizure, and with the frothing from the mouth, etc. The sound is similar to that.
side better, sweetie.
Okay, so Virava Sugarasyeva Vadana Lekhanam. It is told like that. That the sound will be like that of a pig, like that. So this actually it is a myoclonic atonic seizures. It is type DOO syndrome, etc. can be correlated like this. Begins in early childhood. The onset of EMATS or DOO syndrome is often abrupt. It is stormy. The explanations given here is I just gave that video, to show you the sound of that pig sound that is being mentioned in the classic. But the explanation of the seizures that is being mentioned, it is talking relevantly, shaking of head, falling down, biting the down, lying in downwardly, and it is rubbing the floor. So it is a very severe type of stormy like of episode that is being explained. And it can be mentioned as a myoclonic atonic, DOO syndrome, etc. like that. Onset of many seizures and seizure types, often generalized tonic-clonic and myoclonic type of seizures. So it affects the behavior, the executive functions, and ataxia are often evident. And behavior disorders such as hyperactivity and aggression and sleep disturbances are also common during the active phase. So this is the EMATS or the DOO syndrome. This can be considered. Or when you discuss about Ekadasha Apasmara, this syndrome can be considered. Okay. Then the treatment is mentioned is Nasyam with Nirgundi Swarasam and Karavi Swarasam with the breast milk. So Nasyam is mentioned. Then Anjana is also mentioned. Since in difficult or generalized tonic-clonic type of or myoclonic type that leads to tonic-clonic type, they have mentioned Anjana also. Marija Churna triturated in Drona Pushpi Swarasam. So Marija Churna triturated in Drona Pushpi Swarasam can be used for Anjana. Then Grandhigadi Thailam or Grandhigadi Kridam is mentioned for Panam, Nasyam or Levanam. Okay, Levanam in Jihwa or Levanam in Sandhis. Okay, as Todu Thailam. So this is the Ekadasha Apasmara. So now coming to the Dwadasha Apasmaram. Dwadasha Apasmaram is usually seen in the evenings. Madhyane va pradoshe va hritkamba shireso brahmaha padanam nashta sapnyatvam asya phena. So coming from the 11 onwards, the seizures are actually severe type of tonic-clonic type. Dendeshu dendei rakhado todas dendeshu dendei rakhado talabhyam kshidavadi. So shaking of head, loss of consciousness, discharge of frothy saliva, biting of teeth, hitting the floor with hands, scratching the eyes, scratching the floor or on body with nails and redness of eyes. Okay. So vigarasya esya rektatvam netrayoscha prajayade tam dwadasha apasmarena vijaniya. Okay. So this can be taken as a benign Rolandic epilepsy, that is self-limited epilepsy syndrome with centrotemporal spikes. In that, focal seizures with dysarthria, celoria, dysphagia, and unilateral clonic or tonic-clonic movement of mouth in wakefulness or sleep, and or nocturnal focal to bilateral tonic-clonic seizures in sleep. So that is towards the end. That is why I have told about that it is madhyane va pradoshe. So either in the afternoon or in the evenings it happens. That is the Dwadasha Apasmara. So this benign Rolandic epilepsy that now called as SELEX, this also usually happens in the evenings or usually during the sleep time. So Dwadasha Apasmara can be taken as benign Rolandic epilepsy. Okay, when you consider discussing about this thing, you can take this SELEX. Okay. Then Dwadasha Apasmara, the treatment mentioned is Haridaladi Guliga in Stanya internally, then Pashupada Kridam internally, and Badari Patra Swarasam. Badari Patra Swarasam is mentioned as Nasya. Okay, so this is Haridaladi Guliga, Pashupada Kridam, and Badari Patra Swarasam for Nasya. So that is the Dwadasha Apasmara. Then 11 and 12, as I already discussed, it is a severe type of seizures. Both type of seizures are severe. Then Trayodasha Apasmaram, actually it is not so severe, mentioned not so severe like that. Esse sarvaha pranashyanti cheshta sarvanga samasraya sapnyahanisha penasya nirgamaha prajayade. There is no movements explained. That is what I am telling about in the Trayodasha Apasmaram. So loss of body movements, loss of consciousness, discharge of frothy saliva. So it can be something like that of a atonic or maybe an absent seizure. Like that, without motor movements like that. So this is a simple type of absent seizure in which you can see that the patient is now unconscious. The patient is not conscious. I mean, patient is not aware of the surroundings. Patient
Vishal?
is not aware of the surroundings.
Vishal?
He's conscious, but he is not aware
Vishal?
of the surroundings.
Vishal?
So cheshta, pranashyanti cheshta. So he has lost all the
अब ठीक
cheshta.
हो? क्या हुआ था बेटा तुम्हें?
Sarva pranashyanti cheshta. Okay. So that is being explained in the Trayodasha Apasmara. And for that, you have mentioned the Nasya with the Malsyanda with the Stanyam. So it is mentioned for Nasya. And to take Pashtapada Kritam internally, and also Haridaladi Guliga internally. And along the Krida should be given along with the Durga Mantra. Okay. So the Guliga should be taken with the Durga Mantra. So this is the Trayodasha Apasmara. Okay. So we have discussed 13 Apasmaras now. Now only 5 more Apasmaras are left. That is the Chadurdasha Apasmara. So Chadurdasha Apasmaram, no, it is Parshvena Padanam Yasya Grivayascha Vivartanam. Parasparena Dandanam Sandamsham Fena Durgamam Udvritta Netranganam Akshevam Aksheva Andarandara Jayande Apasmridim Tasya Vijaniya Chadurdashim. So it is falling down sideways. So we have seen a video earlier, and we have already discussed about HHE, no, hemiconvulsion, hemiplegic epilepsy syndrome. So biting the teeth, turning neck to one side, discharge of frothy saliva, protrusion of eyes, convulsions, etc. And it is said that if no nasya is done within 7 days, the patient will die. So, and it is Kanya Shigru Rasadi Kridam is mentioned for nasya, and also Levanam in the Sandhis. Okay, so that is the Chadurdasha Apasmara. So, Kanya Shigru Rasadi Kridam. So, we have already discussed the HHE, no? That is the hemiconvulsion hemiplegia epilepsy syndrome. That we can take it in this Chadurdasha Apasmara. Okay. Now, coming to the Panchadasha Apasmara, that is the 15th one. Padangushtat Samarabhya Dakshinadisya Jayade. So, it starts from the Dakshina Pada. Then, Sarvanga Vyabini Suptihi Padanam Cha Vijittada. It starts from the Dakshina Pada, then it spreads throughout the body. Sarvanga Vyabini Suptihi Padanam Cha Vijittada. Tasya Panchadashi Vidyat Smridim Smridim Amrishyadu Nisapnyatve Dhamedu Mandra Mucharya Karnayohu. So they have, it is from focal to generalized epilepsy. It starts from a point and it spreads throughout the body. Okay, so numbness starts on the big toe and spreads throughout the body, falling down to the floor, and then loss of memory. So that is the Panchadasha Apasmaram. And the Thailam mentioned is Shringa Thailam. Shringa Thailam is mentioned for Nasya, and it is made with the, as you all know, this Kombanjabi Gulaga you may have heard. So likewise, it is from made of the horn of different, I mean, Shringa of the different animals. Okay, Shringa Thailam. So that is mentioned as Nasyam, and for Levanam in the Sandhis. So that is Panchadasha Apasmara. Then coming to the Shodasha Apasmaram. Shodasha Apasmaram is said to occur only during Nidra. Nidrayam then the Sangharsho. Bhishma Vastu Nirikshanam. Actually, this Panchadasha Apasmara, no, we have already, it starts from focal to, starts as a simple focal epilepsy and becomes the generalized tonic-clonic type of seizures. Okay, so that is the Panchadasha Apasmara. Then Shodasha Apasmaram, it is Nidrayam, then the Sankarsho, Bhishma Vastu Nirikshanam, Vigrudasya Swarasya Uchcher Nirgamo Nashta Sapnyada, Trishoscha Rektedani Jayande Esya Dehinaha, Shodasha Apasmriti Krastam. So biting the teeth at night during sleep, then dreaming perilous things, and it happens during sleep. Okay, and crying and loss of consciousness and redness of the eyes. So that is being mentioned in this Shodasha Apasmaram. Shodasha Apasmaram occurs during sleep. That is the main important thing. See, the child is sleeping nicely, and during sleep, the child starts having the seizure. See, then the Sangharsham, or the movement of the mouth, etc. during the sleep starts. See the seizure starting.
Skylar. Sean. Levi, come here. Sweetheart.
So sorry,
Sweetheart, stay with me, Levi.
So Nashta Sapnyada,
Sweetie.
movement of eyes, everything is there.
I'm right here with you, sweetheart. Hold on, Levi. Go get Tegan. Levi.
So like Pishma Vastu Nirikshanam. So likewise from the facial features, now we will feel like that. So so Nashta Sapnyada and tonic-clonic seizures. Okay. Okay. So this is the Shodasha Apasmaram. Shodasha Apasmaram occurs in sleep. Okay, then Shodasha Apasmaram, the treatment mentioned is Nirgundyadi Gulika. It should be titrated in Ajamutra or Krishna Gavya Mutra, and it should be Anjana should be done during this time. Nirgundyadi Gulika. Then Pashupata Krida and Mahakalyanaga Krida should be given internally. So that is the management mentioned for Shodasha Apasmaram. So Shodasha Apasmaram is the Apasmaram that happens during sleep. Okay, it can also be considered as the seizure that happens in the evenings that we already discussed. Okay. So then coming to the Saptadasha Apasmaram. This Saptadasha Apasmaram, no, it is considered as the severe type of Apasmaram, and it is Aditrishna Angasadasha. All the features are there. Angasadasha Karnayoho Kshvalanam Tayoho Bhuyaha Samavritattascha Nidraya Malanirgamam is mentioned. Then Krishna Bodhaha Anischa Badanacha Kavasrava Kuksher Atmanam Angepyaha Svedodaga Samudgamam Shobasha Gandayor Esya Jayande Tam Vinirdishe Saptadashya Samavishtam Abasmritya Chigilsakaha. So there is no treatment as mentioned, and it is said that you don't have to do any treatment. It is asadhya. Okay, so it can be dealt as the last stage of a generalized tonic-clonic seizures where the patient presents with the cardiovascular and other respiratory features. Okay, so that is the Saptadasha Apasmaram. So among all these Apasmaram, the asadhya one is the Saptadasha Apasmaram. I mean, not treatable. Pratyakya, not treatable. It is told that you should not do any treatment. Okay, so that is Saptadasha. Ubekshidaha. It is told that you have to what? You don't have to treat that patient. Saptadasha Apasmaram. Then coming to the last one, that is the Ashtadasha Apasmaram. In Ashtadasha Apasmaram, it is told that Gatrasado Viviktasha. So the patient likes to be in solitude. Shairavi Adomukham. Then patient lies down in the back or lying downwards. Then the prone position. Then Pubhaga Alevanam, then there Agasmadharayo, then laughing and crying without any reason, then loss of consciousness, etc. are mentioned. So many behavioral issues are being mentioned, like that we have explained in the temporal and parietal lobe epilepsies. We have mentioned many behavioral issues. So likewise, Ashtadasha Apasmaram looks like that of a temporal and parietal lobe epilepsy. The treatment mentioned is actually mantra, that is Shanti Durga mantra, and another one long krida, a big yoga is mentioned, that is Apasmara Kulandaga krida. Apasmara Kulandaga krida is mentioned in Ashtadasha Apasmara, which can be used for Nasya as well as Pana. Okay, so that is Apasmara Kulandaga krida. So that is the Ashtadasha Apasmara, the 18 types. So we have discussed the all 18 types of krida, I mean Apasmara, and I have tried my best to have a link with the what is being explained in the epilepsy syndromes and the modern classifications of the Apasmara, I mean epilepsy. If you have any comments or any other suggestions on this relation of this Ashtadasha Apasmara, then we can discuss later. So towards the conclusion, I will conclude that the 18 classification of Apasmara may be considered more advanced than the other type of classifications. Actually, I told you now when it actually correlates or it actually simulates with that ILAE 2017 classification, the 18 types, but with the only 4 divisions of epilepsy. Actually, it is not all cases of epilepsy cannot be included in the 4 types of epilepsy, because there are different patterns and different types, different presentations in each cases. So this type of classification seems to be more advanced and more scientific. Okay. Then this classification resembles more with the latest ILE 2017 with respect to the semiology and also the prognosis. Okay. So prognosis is also considered in this case the prognosis as per the different asadhya. Likewise, no prognosis, and in ILA 2017 also most of the epilepsy are considered as curable. In Arogyarakshakalpadruma also only 5 are considered as asadhya. That is the Panjamam, Shashtam, Navamam, Chadurdasham, and the Saptadasham. So these are considered as asadhya. All others are said to be have treatment. Okay, so the Panjamam, that is 5th, 6th, 9th, 14th, and the 17th. 17th is not at all curable. The other 4 is considered also asadhya. Okay, so that number of epilepsies which are asadhyam is very less when these 18 apasmaras are considered. Then the etiology is mainly considered as grahas in this 18 classification. And the treatment includes mainly Nasya and Anjana, and also the Todudailam I mentioned, no, the Leba in the Sandhis and the Jihva, and also the Krida internally. So that is the another treatment mentioned, main treatment is mentioned. And the ingredients of yogas include Jangama Dravyas. Many Jangama Dravyas are being used in the yogas. Okay, and it needs actually further research in this 18 type of Apasmara, in this Ashtadasha Apasmara classification. And I think as Kaumara Vritya practitioners, we should all come forward with future research in this Ashtadasha Apasmara. Okay, so with this I conclude. Hope you have benefited from my presentation. If you have any queries or any suggestions, please come forward. Thank you very much.
Thank you, ma'am, for the wonderful session and elaborating all the 18 types of Apasmara and the Chikitsa, along with the possible modern correlations and videos. We feel so proud that Arogyarakshakalpadruma, a Kerala Balachikitsa Grantha, has got such unique formulations which are not found in any other classics of Ayurveda. As Kaumarapitya practitioners, I think we all should go through this textbook and must utilize these formulations into practice. Now the session is open for discussion. Dear delegates, if you have any queries, kindly put in the chat box. We have already some questions. First is the reference of Bagula Patrotha Pasma.
Bagula Patrotha Pasma. I think the yoga I can share it with, because if I include the yoga in detail, no, it will be a very elaborate session. So that is why I didn't mention it. I think I will share it in the group. That will be better. Bagula Patrotha Pasma. So I will share it in the group. It is in the Arogyarakshakalpadruma itself. So I will share the detailed yoga in the group.
Okay, ma'am. Next question is, when should be the application of medicine on Jihva to be done, and whether it is during the episode or after the episode?
It is actually told to do during that Vega Avastha. This Nasya, Anjana, and the application of this medicine in that Jihva is said to be done during the Vega Avastha. So when that seizure happens, you have to do this application. Actually, in our department, no, we have in the before, say around 10 years ago, we have done this Pradhamana Nasya, etc. during this epilepsy. But the problem is that for 1 or 2 minutes now the episode will stop. So that we have experienced if you do this Tikshna Nasya. But the problem is if the seizure does not stop, and if you refer the patient, then it will be difficult because they will find that you have done some medications in the nose, and it will be usually a conflict between the emergency practitioners and the Ayurveda. So that is why, and application of medicine the jihva is in the Vega avastha.
Okay, ma'am. The next question is, in Panchagavya Grida, we use the byproducts of cow. Should it be from one cow or different cows? Can we use those from bull, as many cows are given estrogen injection nowadays?
I think it is better to use it from the cows. It is Panchagavyam, it is told. That's Panchagavyam. So better to use it from the cow itself. And better if you use the products from cows that are being fed with the natural food. That means the green leaves and water and like that. Not that the estrogen or other artificial cattle feed, etc. That will be more beneficial. But in our scenario, no, in our present scenario, I don't know if we can follow this thing. But still, farms are there where they give only natural food. So then you can use that.
Okay, ma'am. The next question is, does all adult epilepsy comes under Ashtama Apasmara?
No. It is not like that. I mentioned that in this 18 Apasmaras, the Ashtama Apasmaram is explained only for adults. So that is what. Ashtama Apasmara is not only in adults. I mean, adults have not only this Apasmara. In this textbook, particularly Arogyarakshakalpadruma, this Apasmaram is mentioned for adults. Adults can have all the other, maybe all the other types of Apasmara.
Okay, ma'am. Next question is, in case of Lebana on Sandhi and Sira, is there any specific Sandhi and Sira to apply the Lebana?
Usually we apply in all the main joints like Kurpara, Janu, all joints, all the joints mainly, and also in the marmas like Shankha, then in the Brahma, in all the marmas in the Shiras, etc. We usually apply the Todudail. That will be more effective.
Okay, ma'am. Next question is, what is the time duration for Gridapana in these conditions and for how many days?
Time duration has not been mentioned particularly. You can give Krida according to the condition of the patient. And since it is it's a chronic disease, it cannot be treated immediately. It cannot be managed immediately. Say you have to give Krida, and as Krida preparation is a safe drug, no, we can give it as per. And we have already told you, usually in modern medicine we give 10 years gap. That means 5 years with anti-epileptic drug without epilepsy. Then after that 5 years without drug. So likewise, we also have to follow the patient. Give the medicines for at least 2 years. Earlier it was 2 years. At least 2 years. Then you have to without epilepsy. So we may have to continue the Krida.
Okay,
as long as the picture subsides.
Okay, ma'am. Next question is, in Apasmara, when should be the Nasya in adults should be done, and which type of Nasya?
Nasyam is mentioned during Vega Avastha also. So during Vega Avastha, Tikshna Nasya is mentioned. Then after that, for removing the dosha, utklesha in the shiras and like that, you have to do Marsha Nasya. Say after Snehana. Usually in our practice, we do Snehana, Svedana, and first the Shodhana in the body, like Vasti or Virajana, like that. Then we do like Shirodhara or something like that. And after that, we do the Marsha Nasya. So that is the usual, because Utklesha should happen, no? For that we do the Dhara and all. Then after that we do the Marsha Nasya. So that protocol you can follow in adults also. And after that we can also follow some Pradimarsha Nasya like that. Say Varanadi Kshira Kridam for Kapaharatvam, Kshira Bala for Pitta Shamanatvam. Then say Anudailam for Srodha Shodhanam. So likewise, you can use different formulations as per the condition of the patient, which dosha the patient has. And even Swarasa people are using for Nasya, but it should not be continued for long.
Okay, ma'am. Next question is, if a child is below 10 years, how could we manage instead of Nasya as it is not recommended for them?
See, Nasya is not, Nasya is recommended. Ajanma Maranam Shastam Pradimarshastu Vastivad. So you can do Pradimarsha Nasyam in children. Pradimarsha Nasyam we can do in safely in children, and we are doing also. Okay, so Pradimarsha Nasyam you can do it is from birth till death. Only thing is that you have to do Marsha Nasyam only after 7 years. So for children below 7 years, you don't have you cannot do Marsha Nasyam. So below that you can do Pradimarsha Nasyam. No, with the same drugs you can do Pradimarsha Nasyam.
Okay, ma'am. Next question is, febrile conventions, the 9th one. How many days can we use the Tulasi Patra Swarasa Nasya, or only in Vega Gala?
In actually Tulasi Patra Swarasam, it is mentioned during that Vega Avastha. But you know the seizures, no, sometimes seizures, one episode it may subside. Then after that, sometimes in the evening or say after 3 or 4 hours, sometimes there is always a chance for another seizure. So you may continue that also. But this Swarasa Nasya, no, it is very Tikshna. It should not be continued. It may be used for say 2 or 3 days. Then after that, you have to stop. In chronic sinusitis cases also, we use this Swarasa Nasyas, but that also only for around say 1 week. After that, we stop. Because it is Tikshna, Sapnya, Prabodhana, etc.
Okay, ma'am. Next question is, under Tridiya Apasmara, Arya the Eranda mentioned for Juha Lebana, and what is the drug Arya?
That is Kiryat. Kiryat we say in Malayalam. Kiryata Tikta.
Okay, ma'am. The next question is, a patient of 10-year-old diagnosed with Lennox-Gastaut syndrome, epilepsy always appeared to the patient when he is slightly touched with stairs, and also always convulsions comes in every morning. And what medicine should I give? And I have kept the patient on Mahakalyanaga Grida and Malsandi Kwada. And what more can I add? That is the question.
Then actually we have to discuss the case in detail, which dosha predominance is there. LGS, no, we can have we discussed about the 11th, 12th, etc. Type of Apasmara. I actually, I thought of explaining about LGS, but I just forgot. That is 11th and 12th. So in LGS, no, even in LGS, we have to consider which dosha predominance is there in our concerned patient. Then we have to discuss, and then we can give either Kalyanagam. No, it is like Vada Kava Shamanatvam. So it is, if it is the clinical feature is that of Vada Kavaja nature, then we can give Kalyanaga Krida. Otherwise, if it is more Kavaja type, we can give Panchagavya Krida. And this Vilyo Panchanga Kridam, no, this is very effective. You can try for this Vilyo Panchanga Kridam. You can prepare that and give, and it is actually very effective in this type of intractable epilepsies. And if it is pitta dosha predominant, then you have to first reduce the pitta dosha, and either you can give Brahmi Krida or Mahatiktaga Krida, etc. like that. So I think if you have any doubts, we can discuss the case in detail, either WhatsApp or mail me, then we can discuss.
And one more question. May we use Panjaravinda Vardhana Tailas Nasya in Apasmara patient?
Maybe. I don't have an experience of using that Thailam, because we are using many other types of Thailam. Seems to be Pitta Shamana. So you can use that in case of Pittaja Apasmaras. I don't have any experience in this Thaila. If any others have, please unmute and give your comments, please.
Any more questions? I think no more queries. And so we shall wind up today's session. Once again, thank you all. Let's meet tomorrow at 6 p.m. And tomorrow's presentee is Dr. Roshni Anuruddhan, Professor and HOD Department of Kamarapratya, Government Arts College, Thiruvananthapuram. The topic is Clinical Guidelines for the Selection of Aushadha Yogas, Procedure-Based Therapies. See you all tomorrow and thank you.
Thank you all. Good night.